The team was in the community and held an open engagement with the residents as part of measures to curtail further spread of the disease. The meeting held at the Chief Palace saw several of the residents in attendance, especially women and girls whose responsibility is to ensure water is available at home due to gender roles and strict cultural norms. The East Mamprusi Municipal Director of the Health Service, Mark Abugri, who had earlier confirmed the disease, led the team to the community.
Came and look at the situation. We have had, we look at the situation, we've noticed that the community practiced open defecation. Even whilst we're in the Chief's Palace, children were dotting it around. And because of the sloping nature of the community is uphill and the stream is downhill. So when they defecate or all the, poor environmental practice that we have seen, anytime there's rain, the rain washes everything downstream. And that is where they go to drink. And when we got there, we saw there are 2 boreholes just by the stream. And the women will walk past the borehole to the stream. Their reason is that the borehole water is not sweet. But we stress in a meeting in the community, we made them to understand that the safest water for them is the borehole. And that the stream water that they are drinking, with all due apology, we told them that they are drinking their own feces, which I knew that they were not happy about, but that is the reality.
The community of over 1,000 people depend on 2 boreholes. However, due to low yields from these boreholes, the community members said they have had to rely on the stream water to avoid long queues and petty grudges. The team included officials from the Community Water and Sanitation Agency, the Environmental Department, the National Disaster Management Organization, and the Municipal Assembly. The Regional Director, Mr. Gustavo Siakwan, could not say if more boreholes will be provided immediately to the residents as part of the response to avoid a full-blown outbreak.
We saw that even at the immediate surroundings of the boreholes, the environment is really very untidy. Apart from that, even water from the boreholes, because of the unwholesome, because of the sanitary situation around, they've been advised to boil the water before drinking. Whilst we take samples from the boreholes, the 2 boreholes, to the lab to test the quality of it. Then, based on the test results, we advise them what to do next. But we've asked them specifically to desist from using water from the streams. We are going to have a talk with some development partners like UNICEF and Plan. Plan is also just come into the region. We'll have a talk with them and see if they can help with some funds to add a borehole or 2 to the community.
The Municipal Environmental Health Officer, who was at the meeting, also spoke to Joy News about the health advisory issue to the residents.
Plans are far advanced to ensure that the community is triggered under the rural sanitation model and strategy to ensure that at least every household has a a small household toilet for the use of that particular household. We target the refuse dumps where the people are doing open defecation. A lot of flies are breeding, and these flies can even pick the feces that are on the refuse dumps, their houses. So we're doing disinfection with chlorine to ensure that at least those deaths that are found, all germs that are found there are killed. And that one, it will go a long way to reduce the bacterial growth that is likely to affect the people in their rural houses.
On his part, the assemblyman of the community called for the provision of decent water supply facilities.
People are seeing the effect of neglect. They neglected us for so long. I will appeal to any departmental that will come to our aid to add us more boreholes, especially drilling the boreholes in the community and not closer to the stream. If that may not be possible, they can drill boreholes there and mechanize it. We can have water in the community.
Ilyasu Tanko reporting.